Hey guys, welcome to the Inservice on our new vest airway clearance system. The new vest is an upgrade to our older version. However, the settings that you're used to seeing are almost exactly the same. And the navigation on the screen is very simple and straightforward. So this will be a pretty quick in-service. As you can see, it is on a stand. Each wheel is able to be locked. So you would just press down and click on each lock, and that would lock each wheel. You also have a telescoping stand. So if you step on this, it'll actually increase the height or decrease the height depending on whatever your preference is. On the front here, you have 2 ports. This is where your air hoses connect. You will need both of them. This is a remote control. But what's awesome about this unit is you don't have to keep this compressed for the unit to continue to work. You only need this if you can do a quick squeeze that'll start the therapy again from a pause state, or it'll pause the therapy if it's already on the patient running. But you do not need to keep it pressed to have it for the machine to continue to run, which is nice. We're going to use our same vest that we're used to using, so this is going to be familiar to you. And obviously on the back, you do have your, where the air hoses go, the ports, and then this just holds your hose nice and cleanly. So as you can see, I'm just putting my air hoses in the ports like you're used to. Just make sure it's facing these 2 exhaust holes. If you put the tubes in this way towards the seam, then it's just not going to fill up the vest with air very efficiently. And then also, as you can see, as I mentioned earlier, you can just wrap your tubing like this just to keep it nice and clean. And then the other end of your air tubes are going to connect here in each one, and you just have to put a little pressure and they'll stay in there and connect nicely. Okay, so I have both of my air tubing connected, and then I'm given 2 options. I have a normal or custom. We're always just going to use the normal function. So to get that started, I'm just going to click the up arrow to select normal. And then it's going to ask me to confirm settings. Generally, you have 3 different settings that you can choose from. You have your hertz, or the frequency that it's going to vibrate at. And then the center one is your pressure setting for the vest, and then the time that you want the patient to be on the vest and for the therapy to be running. If you wanted to adjust the settings on your patient, all you have to do is just select these up and down arrows to change. So for instance, I have a 1 of pressure. If I wanted to go up or down on my hertz, I'm just hitting the up or down arrows, and then same thing with my time. Most of the time, the settings that are going to be good are anywhere from 10 to 14 on your hertz or frequency, anywhere from 1 to 4 on the pressure, and then we usually run it for about 10 minutes or so. If you ever forget that, there's a little card hanging, a little quick reference card, and you can just take a look at this and it'll talk about the most commonly used treatment time and settings and things like that. So once you have your vest placed on the patient safely, when you are ready to start therapy, all you have to do is select the on button. It's going to initially inflate your vest, but it will not start the vibrations until you hit start again. And the way you do that is start therapy, press on. So I'm going to hit on again. So that will start the vibrations on your patient. If for some reason you need to pause the therapy, you can either do it by squeezing this, or you can just hit off and that would pause the therapy. You can start the therapy again by squeezing, or I could have just hit the on button again to start therapy. And if you'll notice, I do not have to keep this compressed, like I said earlier, to keep the therapy running, which is nice. So once the therapy is done and you've reached the end of your therapy, you can just hit off or wait for the time to expire. It'll automatically stop the vibrations, and then you would just remove the patient from the vest. And it's that easy. Thanks, guys.